Okay, everybody, low testosterone, another common problem in our world today, both in men and women. Yes, women, that's right, testosterone is actually a good thing. Though I know many worry about it causing masculine features, the truth is that it takes a lot to achieve that, simply because you can't produce it in the same quantities as men do. Low testosterone is caused in the majority of cases from high estrogen or high amounts of insulin. And if you've watched my videos on insulin, stress, and estrogen, you're probably thinking to yourself right now, of course it causes low testosterone because everything is connected. So when it comes to estrogen, as you've already learned, most people are living with high amounts of estrogen, whether it's from a gut problem, a liver problem, stress, or insulin. When the body senses high amounts of estrogen, it will actually downregulate testosterone because testosterone is a precursor to estrogen. So this is your body's way of trying not to make more estrogen by not making testosterone. When it comes to insulin, the relationship to testosterone is a little less direct. Increased insulin will increase levels of estrogen, but for this relationship, it's actually more about the frequency of eating. The relationship between insulin and testosterone isn't exactly clear, but what we do know is that peak testosterone release in the body is achieved during a fasted state, and peak testosterone release just happens to be achieved at the same time as when insulin release is at its lowest, which is at the 50-hour mark of a fasted state. There have been many studies that have shown that there is an increase in testosterone release with people who are intaking less calories. This is your body's way of trying to be more efficient and to use the protein it gets to maintain muscle mass. The questions that I often get asked is, what do I eat in order to increase my testosterone? And the answer is literally nothing. I'll have a whole video on intermittent fasting, which can also be very beneficial for increasing insulin sensitivity and decreasing estrogen. But again, we have to go back to the gut for that. You got to improve the gut function and decrease your estrogen if you want testosterone release to be most efficient. Studies have shown that keto diets don't inhibit the fasting effects for testosterone, which furthers the idea that insulin must play some kind of role in downregulating testosterone. Because why would testosterone decrease when eating carbohydrates, but not when eating high-fat content foods? Besides fasting, there is one other effective way for increasing testosterone, and that is through exercise. Testosterone release has been shown to be released during exercises associated with weightlifting. There is a very high correlation of the heavier you lift, the more testosterone you release. Again, because the more muscle we build. Again, this is a response body trying to maintain muscle integrity. The most effective exercise I've seen for this is through variable resistance exercises, because the weight of the lift increases the further you lift with variable resistance bands, challenging your body more than in normal weightlifting where the weight does not change per rep. I'll save the speech for another video on the benefits of variable resistance training, but for now, women will always be limited in their testosterone release because, again, they don't have the same organs that do that. But there is a really good way for them to achieve more muscle, and that is through excessive protein caloric excess intake. Otherwise, the variable resistance training will serve more to tone than build lots of muscle. That's it, folks. Just a quick recap. Or rather, before that, just the other thing I wanted to mention was TRT, testosterone replacement therapy. I know it has benefits to, decreasing symptoms, and if you really don't have any other choice, then you got to do what you got to do. But ultimately, it will keep your body from making its own testosterone and make your body dependent on it, which is a really great risk. And so again, my whole goal for this website is to help your body work better naturally. And again, just to recap, the big things that we want to do to release testosterone on its own is 1, fix the gut and decrease estrogen. 2, decrease carbohydrate intake to decrease insulin. 3, incorporate fasting, be it intermittent fasting or otherwise. Again, refer to my fasting video for a guide on that and the benefits for testosterone. And number 4, incorporate variable resistance training where we are able to lift the heaviest we can possibly lift in a safe way. I hope you find great benefit in this info. Thanks again for listening.